Weather is starting to warm up, and with more people heading outdoors, it's common for people to forget about taking care of their skin. Dr. David James tells us more about the importance of avoiding the sun's harmful rays in this week's Health Watch.
It's the most common form of cancer in the United States, with over 3.5 million cases diagnosed annually. That's why it's so important to know what skin cancer is.
There are 3 types of skin cancer. 2 are very curable, very treatable and curable, basal cell and squamous cell, and then you've got the more serious malignant melanoma that can be life-threatening.
There are many ways to protect your skin from these types of skin cancer.
The best way to protect our skin is to stay out of the sun between the hours of, say, 10 o'clock in the morning, 4 o'clock in the afternoon. They've actually even lengthened that time. We recommend that you do wear long-sleeve clothing, that you do wear a hat that protects the face, the top of the ears, the nose, so that it needs to have a rim around the hat. And then most importantly, when you are out in the sun, even just for brief periods of time, getting in and out of the car, going into buildings, we should always wear sunscreen.
For sunscreen, it's recommended that you use SPF of at least 15, and for children, it's recommended that you use SPF 30.
You need to reapply the sunscreen if you get wet, or if you're doing a lot of heavy exercise and maybe sweating, you need to reapply the sunscreen.
And to recognize potential cases of skin cancer development, be mindful of sudden changes in your skin.
If we notice changes, if it's something new, maybe it has an irregular border on it, the color has changed, it's a different shape on one side than it is on the other side, and if it's larger than a pencil eraser, then we really need to let a physician check that place.
The prognosis of skin cancer depends upon a number of factors, including the type of cancer and how quickly it's diagnosed. That's why it's important that any suspicious moles, sores, or skin growths be looked at by a physician or dermatologist immediately. For this week's Health Watch, I'm Dr. David James.